Medicaid is the healthcare safety net for millions of Americans. And during the pandemic, when many people lost their jobs and their health coverage, Medicaid became an even more important tool.
In tonight's Stronger Houston report, health reporter Haley Hernandez focuses on efforts to expand Medicaid coverage to vulnerable Texans and how efforts to oppose that expansion are impacting people in low-income and underserved communities.
Yeah, that's right. So Texas was one of only 12 states that chose not to take additional federal money to expand Medicaid coverage in a political battle that's been going on for years. But in a small step forward yesterday, Texas lawmakers voted to go ahead with a bill that would cover one of the most vulnerable groups, mothers. And now there's new hope for 1 million low-income Texans.
Amber Ayala is a full-time U of H student. She's majoring in psychology, has an internship, and works at a grocery store to pay her way. She's also never had regular doctor checkups. She can't afford them because in her busy schedule, she doesn't work enough hours to qualify for health care benefits. So she typically doesn't go to a clinic unless an illness gets so bad she can't tolerate it.
I had 2 infections in both ears and a throat infection, and I was like, well, how much would that cost? And I realized that I would have to choose.
She comes from a big family. Her mom supports her and 7 other family members on an hourly wage job as a dental assistant. So Amber lives on a wish and a prayer that she doesn't get sick or should be forced to choose between paying for her health or paying for her education.
But usually I just wait it out and try to write it out and hope that I get better within a week or 2.
Amber is like 1 million other Texans who could benefit from Medicaid expansion. Brian Sasser with the Episcopal Health Foundation in Houston explains.
I think for Amber and so many, they're in that gap where they don't make enough to qualify for help under the Affordable Care Act to get cheaper health insurance, but they make too much to be on regular Medicaid in Texas. So this gap there's 1 million people in it, and they're severely affected by it.
This gap hits women and babies especially hard. In Texas, about 1/4 of women of childbearing age have no health insurance. According to the March of Dimes, 20% don't get prenatal visits. And it puts Harris County's preterm birth rate at 12%, worse than the state average, which is already one of the worst in the country. A bill to expand Medicaid for new mothers passed a key milestone Wednesday. Lawmakers voted in favor of a bill giving women access to Medicaid coverage for a year postpartum instead of the current 2 months.
Up to a year after delivery, you can experience still some hypertension and diabetes might come into play that can cause some adverse outcomes. So we really want to make sure that those moms have access to very good medical care so that they can be treated for that.
That bill now moves to the Senate. But what about including low-income working people like Amber in that expansion?
It would just put me at ease and I wouldn't have to worry about that. I don't know if I have an underlying health condition.
Now, a Medicaid expansion, which 69% of Texans support, also saves the state big money. The Episcopal Health Foundation finds $5.4 billion from federal government could come to counties in our area, $950 million in Harris County alone. Now, we have much more on how much money it would provide for health care and hospitals in your county on our website, click2houston.com. Lauren?
All right, Haley, thank you.